Hi there, my name's Hadley. I'm a nurse in the critical care unit, and I am filming this video for my capstone class in my bachelor's program. So I'm going to talk about how I integrate principles from my liberal arts curriculum into my nursing career. The first principle I want to talk about is teamwork and collaboration. We had one course throughout our bachelor's program called Leadership and Administration. In this course, I specifically remember discussing the goals of conflict. And one thing that has really stuck with me is the objective to create a win-win for all the parties involved in the conflict. I'm able to use this in my practice every day when I communicate with my patients or with my coworkers. One area specifically that I like to use a win-win is for the nurses' aides. I remember when I was a nurse's aide, I felt really overwhelmed, and it meant all the world to me when my nurse would try to help me out with something. So, if I really need them to do something, I'll offer in exchange to do something for them. And then we're both a lot happier because we're getting more work done, and we're feeling like we're sharing responsibility. The next area that I want to talk about is evidence-based practice. We had a course that was called Research and Evidence-Based Practice, and this was a really helpful course to me. We identified the top 3 barriers to implementing evidence-based practice in the clinical setting, and the top 3 were lack of time, inability to understand statistical terms, and inability to understand the jargon in the research articles. And that's why these BSN classes have meant so much to me, is because of these classes, I'm able to understand the statistical evidence, I can understand the terms and jargons, and I'm able to be better in my healthcare profession because I can understand evidence-based practice, and I can stay up to date and provide the best care for my patients. The next one is professionalism. We also had a course in this bachelor's program called Professional Nursing Practice. In this course, we discussed professional ways to communicate. And one thing that I'll carry over into my nursing career is using eye contact and clear speech, and how that makes all the difference when you communicate. Sometimes I don't feel as confident when I'm communicating with doctors, but using eye contact and clear speech can make all the difference, and it can help you appear a little bit more confident than you might actually be. Another thing we talked about in this course is the nursing code of ethics versus the Christian code of ethics. And this is really important in my nursing career because, it helps me be held to a higher standard than maybe someone else who's not necessarily a Christian. And it gives me kind of a reason behind the interventions that I do in my nursing career and how I treat my patients. The next topic that I want to talk about is lifelong learning. Lifelong learning is really important to nurses because healthcare is always changing, and we always need to be learning the newest and best ways because research is coming out all the time. So one way that I will engage in lifelong learning is by staying up to date on evidence-based practice. And I'm able to do that from these BSN classes because, like I said, I can understand the statistics and jargon, and I'm interested in it because I want my patients to have the best care possible. Along with evidence-based practice, I am working on a program at work. It's called the STAR Clinical Ladder, and this helps us engage in lifelong learning because we stay up to date on research and getting involved in the community. We put together little informative packets, and we give little presentations to all the nurses on the unit so that together as a unit we are up to date on the best way to take care of our patients. The second way that I engage in lifelong learning is actually through self-care. The more I work in the nursing profession, the more I realize how important it is to fill up your own cup so that you can be the best for your patients and not be drained at work. And I think that self-care facilitates lifelong learning because it prevents me from getting burned out. It prevents me from, not caring and not wanting to do the best thing because I'm tired. So going home and taking care of myself before I can go take care of anyone else, I think is really important for me in my lifelong learning. The next area I want to talk about is servant leadership. So every day at work, I know me and a lot of other nurses are showing servant leadership. As far as with our patients, one way I think servant leadership is important is by advocating for patients. You know, even when the doctor doesn't agree, it's important to tell them what the patient's wishes are and what's best for them. By doing this, you are showing servant leadership because you're serving your patient and you're being a leader even by standing up to a doctor. The second way that we can show servant leadership is through patients' family members. In my short time of being a nurse, I have become increasingly grateful for my patients' families. They're really supportive and they love the patient, and oftentimes the patients love when they're there. And they often know the patient better than I do, and they can identify key changes in personality or condition before anyone else. I show my patients' family members servant leadership by, constantly asking them if they need anything, offering them coffee, water, warm blankets, pillows for the night, and treating them with as much respect and serving them as much as I do my patient. Offering a site consult or social work, if they think the family member needs services after they become discharged. As far as peers and coworkers go, servant leadership is very important in this aspect also. Serving your coworkers is only a win-win. You're able to help your coworkers give a bath, turn their patients, and maybe even give a med for them when they're really overwhelmed. So this allows us to serve them, but then it also makes them more likely to help you when you're in need, because healthcare can get overwhelming and you need support from coworkers and peers and people to help you out. In my personal life, having servant leadership is also important here. It's important to be able to serve your family and friends. I personally think that I'm able to serve my family and friends by listening and encouraging. I've kind of seen a lot of times that my friends just want someone to listen without judgment or questioning. But then it goes both ways, because then they will listen to me, and it helps prevent burnout by going home and being surrounded by loving friends and family to encourage, support you, and then in turn you can serve them by encouraging and supporting them. And then the last area I want to talk about is spirituality. Spirituality has impacted my view of patient care because it gives me a purpose and motivation behind my actions. I know that I want to provide good care for my patients, but I know that me personally, I feel held to a higher level of standard because we're Christians and we want to share love with our patients as well as do all the good medical interventions for them. Spirituality, I feel like, gives nurses kind of like a warmth behind their interventions, and it allows them, an ability to empathize and show compassion. And spirituality is also important to just restore rest. There has been so many night shifts where I've relied on the verse, Isaiah 40:31, "Those who hope in the Lord will renew their strength. They will soar on wings like eagles." So I believe spirituality both sets us apart and holds us together in healthcare.